Hi there, and thanks for everyone for joining us for today's discussion on acupuncture and chronic pain and anxiety. I'm super excited to have today Carrie Myatt. For the second time, we did a great presentation on use of acupuncture in the prenatal and postpartum population. And today we're going to kind of visit the idea of using acupuncture along with physical therapy for chronic pain and anxiety. This is a topic that certainly we hold near and dear to our hearts, and so many patients of ours suffer from chronic pain and anxiety, particularly after the past year that we've all been through, where mental health and anxiety and depression rates are certainly the highest that they've been in a long time in our country. So I'm really thrilled today to be presenting on this topic because I think this will offer a lot of hope for a lot of patients out there. So as we go through today's presentation, we'll talk first about how chronic pain works and what that mechanism looks like from a perspective of the brain and body. And then we'll talk about some of the traditional methods used for managing chronic pain and anxiety, like physical therapy. And then I'll hand off to Carrie, who can talk about how acupuncture can augment physical therapy, as well as serve as a standalone treatment for reducing that chronic pain and anxiety. And having been to Carrie myself, she's a fantastic practitioner who offers such a great view into this world. So I know that everyone will really appreciate seeing that type of therapy. So let's talk first about chronic pain, because there's often a misconception about what chronic pain is, and whether or not someone has chronic pain or what that might look like. So when we look at that kind of that definition of chronic pain, it's really when there's pain that has lasted longer than 12 weeks. And when you think about that, 3 months is a really long time to be suffering. And what we see when we look at the data in the country is that roughly 1 in 3 Americans suffer from chronic pain. And whether that was initially caused by an acute episode or some type of underlying problem, that can vary from person to person. Usually, we see that there was an initial injury that created that pain problem that then worsened, and almost kind of got stuck in a holding pattern in the body. And we'll talk about why that happens on the next slide. But essentially, the patient or the person starts to feel that pain even when the acute injury has actually healed. So maybe that initial ankle sprain from stepping off the curb has gotten much better and the tissue is healed, but the pain and what the pain represents continues to linger in the body and the brain. We certainly see that chronic pain is much more popular or significant in people that have had a history of recurrent pain. So maybe that's from having a back spasm or a back pain that happens every couple months. We'll see that that can actually eventually start to linger and not really have a period of off time. It just stays in that chronic pain cycle. Those who have an underlying condition of depression and anxiety will also experience a heightened perception of chronic pain. And when you think about this, it's almost like a chicken and egg scenario. One begets the other. If you're in a state of perpetual pain, that can certainly make you feel very anxious because you are constantly wondering, why am I in so much pain? And could potentially lead to depression because you're not able to do the tasks that you want to be able to do. So as we explore that idea of chronic pain, depression, and anxiety, we have to really peel away the layers of the onion to determine really what was the initial cause, if that's even discernible. If someone has a history of other mental health disorders, like a bipolar disorder, manic depressive, that can also exacerbate chronic pain. And certainly there's other health conditions that really go hand in hand with chronic pain, like fibromyalgia or chronic sleep deprivation. So we have to really understand all of those pieces, both physically and mentally, that are contributing to that feeling of perpetual pain. And then lastly, those that have a more sedentary or inactive lifestyle can often experience higher rates of chronic pain. And really, this comes down to the fact that our bodies are meant to move. Humans are meant to be mobile individuals. And when we stop moving, it can create a lot of changes within the body that can lead towards having increased pain. For anyone who's had pain, whether acute or chronic, you'll certainly appreciate the fact that pain limits your ability to participate in daily tasks. You're not able to carry the laundry basket up the stairs or maybe get down on the floor to play with the kids. There's significant limitations that prohibit you from doing the things that bring you joy. We also see a significantly higher use of medications, particularly opioids, in patients that have chronic pain. And we know this to be a very severe condition in the United States, given the opioid crisis that our country is currently in. So really, our job as medical practitioners is to provide alternative pain relief so that we can help our clients move away from medication management and perhaps use some of these more holistic options to control that pain. If you've had chronic pain or acute pain, you'll realize, certainly you're not going to be able to do the job the way that you want to do. And this can result in increased work days or days away from work, as well as increase in disability. So, we have to be very mindful about how this affects the person, and all of the different ways that that person needs to function, both in a family and work setting. And then lastly, as we previously discussed, that chronic pain can actually be a precipitating factor towards depression. So whether depression was kind of before the chronic pain or chronic pain resulted in depression, again, this is where this collaborative approach between medical providers can help to, again, peel away those onion layers to find not only the cause, but some additional solutions to help manage that pain syndrome. So let's talk just a little bit about how chronic pain works, because I think this is such an important thing for us to understand. When an injury happens, it triggers a pain response, which travels through the spinal cord up to the brain, and it says, ouch, that hurts. So for example, if you turn your ankle after stepping off a curb, the pain of the tissue is going to send a message up your leg, up to your spinal cord, to your brain, and it's going to say, yowzers, that really hurt my ankle. As a result of that response reaching the brain, there's going to be an increase in calcium release, as well as an increase in stress hormone release known as cortisol. And this causes an inflammatory response to occur at the area of the tissue where the injury occurred, as well as at the area of the brain where the pain is being perceived. So we see this inflammatory response occur in both areas. What happens with chronic pain is when there is an increase in that stimulation that goes to the brain, it can actually cause other areas of the brain that are known as the limbic system to start to centralize that sensation. And what that means is, instead of it being, oh, my ankle hurts, it starts to become associated with some emotions, namely stress. So that original stress hormone release within the brain can actually stick around. And now, even though the ankle isn't hurting anymore, anytime you perceive any other stress in your life, it can trigger that area of the brain to say, oh, my ankle hurts. And so now there's really no longer a physical harm to the body in the ankle per se, but the brain is still releasing those chemicals saying there's an injury, there's an injury, there's an injury, when in fact that injury has long since been healed. So a lot of people that I work with will say, I feel like people think that this is in my head and I'm faking it, or this isn't real, I don't really have a pain. And I have to be really, really mindful in the education piece of saying, well, you have an injury for sure, or you had an injury, but you also have something occurring at the level of your brain. You're not making this up. This isn't fake pain. It's just that the pain is now associated in a different way. And so there's a lot of dissociating that we need to do to help break that pain cycle. So what is the pain cycle? Pain cycle looks like this. You do something, it causes pain. That pain travels up to your brain and says, hey, don't do that anymore. That really, really hurts. So if you turn your ankle, you go to take a step on the ankle and you say, yikes, that really hurts. I'm going to stop putting pressure on that ankle, and you start limping. Well, now you aren't able to walk as far. You're not able to do, walk at all. Maybe you have to sit or, have crutches. And then your brain starts to say, oh, okay, well, I'm not going to do that anymore because it's going to cause pain. And we create this cyclical function of if I move, it causes pain. And pain is going to cause me to not move. And we create this kind of downward spiral that leads towards that further increase of stress response. And what we need to do as practitioners is teach people how to break that cycle of pain so that they don't get stuck in this perceptual feeling of, I can't do this. Oh, if I do it, it hurts. Oh my gosh. And it kind of creates that, again, circling the drain sensation. So certainly, I'll speak on behalf of physical therapy. Physical therapy is one of the key tools used for managing chronic pain because we can help to break that pain cycle by encouraging movement. So we know that movement is one of those key pieces of that cycle. And if we stop moving, it can actually cause more problems. So what your physical therapist can do is teach you how to move properly and safely to help that body part recuperate from the pain injury, as well as to break that fear cycle of the movement. So certainly we want to help, through this process, teach the correct kind of movements. That those movements help to bring nutrients to the area so that we can flush away those inflammatory cells. It can help to reduce your anxiety because you're not as fearful of moving. And then not only is it going to help with the anxiety piece, but as we move and we release those endorphins, which are the good, exciting molecules that make us feel better, we start to break that depression cycle. And we can see that we're getting effects not only at the body level, but at the brain level as well. One of the things that as a physical therapist can be a significant barrier is trying to manage the actual acute pain. And that's where something like acupuncture becomes incredibly, incredibly helpful because it can be a tool to help bridge that gap between, oh, I have pain and I can't move, to now I can move without pain. So I love working with practitioners like Carrie because I can say, hey, Carrie, listen, this person's really struggling in this area with regards to pain. Can you give them some tools or use acupuncture as a tool to help bring their acuteness of the pain down so that I can then move with them more successfully? So let me pass it off to Carrie. She will be able to talk more intelligently about how that actually all works. I think it's just magic because she's so darn good, but she can go through why acupuncture is such a useful tool in managing pain.
Hi. Well, thank you for that explanation. I was kind of taking notes while you were talking because it was triggering things that I wanted to make sure that I touch on too. And that well, first I want to just make sure everyone knows what acupuncture is. A lot of people have heard about acupuncture, or a practitioner like you might mention, hey, get some acupuncture, but they don't know what that is. It can be a little scary and have some fear around trying that. But acupuncture is the insertion of very thin stainless steel sterile needles into specific acupuncture points in the body. It's a main component of traditional Chinese medicine, which is sometimes also termed East Asian medicine. So, other components being electrical stimulation, cupping, gua sha, moxibustion. Those are all great for pain management as well. A lot of the studies I was looking at when I was preparing for this talk was a lot of the studies for pain management do include electrical stimulation, the use of electrical stimulation, which I use sometimes in my practice, but not always. And acupuncture can be used to treat many types of illnesses and disease. Pain is, I think, one of the most popular things people seek acupuncture for, both acute and chronic. Also, stress, anxiety, digestive disorders, hormone disorders, fertility, especially in my practice, I actually treat a lot of fertility, allergies, sinuses, nausea, both in chemotherapy and pregnancy, and much, much more. And this is a picture. It's actually, I'm needling, it's my husband. And he has a couple points in the face. One of them, actually, yin tongue right in between the eyebrows, is really commonly used to help calm the mind. And I'll kind of talk about why when someone comes in for pain, let's say it's chronic low back pain, I might utilize a point like this just to help And I'll explain why I'm doing that, just to influence the brain and break the pain cycle. I'm sure I might put some needles in the back for the back pain too, but it's really looking at the whole person. So sometimes I might utilize a point like this as well. And this is a picture of the body, all the meridians on the body. Probably not all the meridians and all the points, but it gives you an idea that acupuncture is meant to stimulate specific acupuncture points along meridians, also called channels or pathways, thus affecting the flow of chi, which we roughly translate to the body's life force energy. Um, and the acupuncturist, we're trying to create balance and harmony and proper flow of chi throughout the whole body. I also use the metaphor of thinking of the pathways, the meridians like rivers, and rivers need to be running smoothly, connecting with each other smoothly. And sometimes you can have what we call stagnation, which is pain. And it's almost like a big boulder has set itself in the middle of this beautiful river, and it's creating lots of disharmony and chaos and pain. And our job is to try to remove that boulder to allow that free flow of energy and blood throughout the whole body. In Western terms, because I find that I personally like to understand from a Western perspective what is going on, why is this working. I think I love that there still is a little bit of mystery in Chinese medicine and in acupuncture. But essentially what modern testing, which has allowed us to understand more why acupuncture works, it's been proven to release endorphins in the body. It's the body's natural pain killing chemicals. So we can increase the endorphins in the central nervous system and affect how the person's perceiving pain. That you have that sort of feel good feeling after acupuncture. And a lot of that is from that endorphin rush. And we can also affect, I think the mental and emotional state of someone living in chronic pain is huge. I think more than most people probably realize. And acupuncture can also release more serotonin, that feel good neurotransmitter. Acupuncture can be great to help with anxiety and stress management in a really nice, subtle, beautiful way. We also increase blood flow to the area, and we're basically helping the body heal itself. You're stimulating the body's immune system. The body is so brilliant and smart, and it knows how to help itself. Sometimes we just need to kind of help it along. Um, yeah,
Now, I will
in
say,
a
Carrie,
nutshell.
I love how you said, the mystique of acupuncture, but then it's understanding kind of the Western scientific part of it that complements it. And one of
Yeah,
the things in physical therapy that I think speaks to that same idea is the power of touch, and how touch has these incredibly mystic feeling components to it as well as scientific components to it. And I think of acupuncture in a similar way, where certainly we recognize that, laying your hands on someone or utilizing a tool like this has, a little bit of mystery behind it, but there is also this scientific evidence that shows that people inherently do better
yeah,
when they have this as an available tool. And I think the part that's so wonderful is, especially with chronic pain, we need to try a lot of tools, right? Some tools work for some people, some
yeah,
tools work for others. And so having acupuncture as an option, or having physical therapy as an option, or having cupping as an option are just additional tools that we can try to see how your body corresponds and relates to that
yeah.
input.
Yeah, every body is unique. And what works for one person might not work for another. Just like I'm not going to cure every single person that walks in my door. I wish I could. And that's a conversation I always have when I'm treating pain, is you always have that conversation of, expectations, and acupuncture can be dose dependent. When can I expect to feel better? So that's always something, whether no matter what acupuncturist you're seeing, have that open communication with your practitioner to find out, is this the right thing for me? So I was very pleasantly surprised and happy to look at the current research for pain and acupuncture. I live in the fertility world quite a bit, and the research around fertility can be inconclusive, and it's new. But man, the research out there for pain management and acupuncture was very inspiring. I try to find a somewhat recent, just kind of meta-analysis of, if in case people were wondering or curious about acupuncture specifically for chronic pain. And this one meta-analysis looked at studies up until like December of 2015. This was published in 2017. Um, you know, 20,000 patients, 39 trials. So I feel like it was a pretty robust meta-analysis, and that acupuncture was superior to both sham acupuncture, as well as a no acupuncture control groups. A lot of people say, oh, it's just a placebo and acupuncture doesn't really work, but it was shown to be superior to the sham acupuncture. And so sham acupuncture is, it's like, it's kind of like fake needles in non-acupuncture points, which some could argue you're still stimulating the area. So that's why you do get a little bit of a difference, but it's still true acupuncture is still statistically significantly better than sham. In a lot of this was looking at all types of pain, back pain, shoulder pain, knee pain, headaches. Um, and what was great is this study, as well as other studies I looked at, found that acupuncture held its own over time, that patients with chronic pain saw an acute shift and decrease in pain and quality of life, and it persisted. And in a lot of the studies, it persisted past, traditional Western approaches. What's nice though is there's a lot of studies looking at, acupuncture and, acupuncture combined with traditional Western. And sometimes you need that combination, just like sometimes I'll tell if I'm not making headway and I'm not making any shifts in the pain management, that's when I sort of stop and have that conversation of, okay, do we need to maybe look at something else? Are we missing something? Do we need to go to a chiropractor and look at structural alignment? Do we need to go to a physical therapist? Do we need to get more imaging? Sometimes I've told my patients, unfortunately, you might have to go back to your surgeon, so I try to be realistic, but, trying to combine multiple types of healing is sometimes the best.
I think the other part of this conversation too, Carrie, that's a good one, is that idea of control, right? And empowering our patients, educating them about pain and how they can take control over the pain. Because oftentimes what I see in my years as a PT is that people start to let the pain control them. And then there's this sensation of helplessness, which can lead towards anxiety and depression.
Mhm.
So pain is very, very complex in that nature, and that we need to show pain that we're in control. And that can be through a variety of different tools, like modalities, like physical therapy, acupuncture, whatever. It can be through things like meditation. It can be
Yeah.
through a variety of different ways that we teach our patients how to control the pain instead of having the pain control them. And I think that's one of the largest parts of my practice as a physical therapist, is really educating patients on how they can take control of the situation, and then providing them with the tools that will help them succeed in that control.
Yeah, that's a very good.
So, and I love the other piece of this lecture that I hope people really embrace, is that managing pain is very multidisciplinary. It requires a variety of different inputs. It might mean having a chiropractor. It might mean having an acupuncturist. It might mean a psychologist, or it might mean medication management for a certain portion of time. And all of those are really excellent tools. And the practitioner that is open to combining all
Mm.
of those is the best that's going to help to manage pain, because they're the ones that recognize that this is such a multifaceted process that needs to be managed on a variety of different levels.
True, because I think all types of healing disciplines have their strengths and their weaknesses. And another thing that I wanted to mention too, when you were talking that I was thinking of, I didn't really put too much in my slides. I don't think, maybe I put it on the next one. I can't remember. Um,
Click ahead
was
just to see.
yeah, sure. Um, yeah, I didn't really talk about the role that emotions can play in chronic pain, which I feel like needs addressing too. And some patients are um, kind of ready and willing to think in that way and work in that way. And maybe some people genuinely don't need to. Maybe it's, no, I fell, I twisted my knee. I don't have some deep psychic pain and it's manifesting in my knee. But sometimes there are emotions, and I'll never forget my first class I took in acupuncture school. It was acupuncture 101. It was Chinese medicine theory, and the first thing they talked about was the seven emotions that cause pain. And I was like, what? Like um I I wasn't raised in I was raised, traditional Western ways. So this was something very different and new for me to wrap my head around and understand. And I've just seen it over and over again where sometimes it really was an emotion that people really can hold emotions in the body.
Mhm.
And there's some schools of thought too that even say, back pain is about, trying to, like, you're carrying everyone through life, or, I've seen things like that. I've seen jaw pain, for example, be associated with anger. I've needled someone in the jaw to, or even in the head too, if it's like chronic headaches. I've just released a muscle and then tears come for the patient. And that's happened over and over again. And sometimes the patient was expecting it to happen. And sometimes it was a surprise to both of us, because you don't really know what's in there. And I think too, like yoga can be an amazing form of healing for people in chronic pain once they can have that movement aspect. You said, like, stop having that fear of movement. Yoga is amazing because yoga is similar to acupuncture. Is the whole body is working, the brain and the body are doing the work together. And you hear all the time about in yoga, someone, does a hip opener stretch and they start crying in the middle of the yoga class because it just released something. So sometimes too, we can go to that level. There's so many different levels that acupuncture can reach. And so sometimes too, if there is an emotional component, acupuncture is a healing therapy that might be really helpful for that person.
Absolutely. Absolutely.
Oh, I did put the can't talk about cupping without Michael Phelps, right?
How about it, right? Like, look at those marks. And yeah, I think the other thing too, just to kind of also highlight, Carrie, what you had mentioned before, is there's so many other tools that acupuncturists can use,
Yeah.
like stimulation, cupping, gua sha, moxibustion. And certainly, if there's anyone out there that's interested in those topics for a future lecture, drop us a little message in the post afterwards, and Carrie and I can hop back on and explore some of those as well. Because what's fascinating about both cupping and gua sha is there's also Western versions of both of those. We call it IASTM, or instrument assisted soft tissue mobilization, and then cupping as well. So we see that transcends kind of the continental divide, or the oceanic divide between Eastern and Western medicine. And I think that they're very fascinating mechanisms. So really, in conclusion for today, acupuncture and PT can help both together as well as independently to help restore normal tissue function. And in the end, the idea is to promote that movement. We want the body to move. We want to break that fear cycle and that pain cycle so that the body is able to do all of the beautiful things that it's meant to do. If pain is limiting someone's ability to endure that movement in physical therapy, acupuncture is a great way to help reduce that pain and lower the acute acuteness of it. And vice versa. If someone is receiving acupuncture and maybe isn't quite getting the full spectrum of benefits, the movement offered through guided physical therapy might be what helps to transcend them beyond that plateau. And so I think these two interventions work hand in hand in helping to really promote that optimal movement. And again, at the end of the day, they are two tools available. Just like medication is a tool, just like a chiropractor is a tool, just like there are hundreds of tools available. But these are tools available to help break that pain cycle. And really, at the end of the day, Carrie and I want those out there listening to know that we're here and available to help, whether that's to utilize our tools or to help point you in the direction of some additional tools in your area that could help you. So certainly, if you are interested in reaching out with any questions or for a free consultation, since both of us do free consultations, you're welcome to reach out to us at our email accounts, which are listed here, kwilson@reachyours and carriemyattacupuncture@gmail.com. And for a special thank you for joining today, if you're interested in some of my favorite stretches to help reduce pain, check out reachyours.com/back pain. While the exercises are fantastic for back pain, they're also great hip openers. They're great for the cervical spine or the neck. So these are some really nice options to help you kind of dabble in that idea of getting the body moving again. So I want to say a special thank you to Carrie for her time today. Always a pleasure to be with you. And certainly we are available to anyone out there if there are any other questions, because we know chronic pain can be hard, and we want you to know that there is help available. So thank you very much for joining us today, and we will be here if you need us.